What do you do when you have a skin flap that fails twice and you're in a lot of pain and you don't want to have to take pain meds for the rest of your life? Well, that's what we're going to find out today with my friend Avery here. Hi, Avery.
Hello, how are you?
Good. How are you today?
I'm feeling really good.
Yeah, you just got done down the hyperbaric chambers, and you should feel pretty fantastic, right?
Yeah, really good.
Awesome.
Yep.
So let's talk a little bit about your history.
Yep.
So what brought you to see us?
Yeah, so I had 2 failed skin grafts on my vascular anomaly or birthmark on my ankle.
Mm-hmm.
I decided to get a skin graft because it was messing with my work, super sensitive to the touch, and just messing with my life. And I had heard about this on Facebook and wanted to try it out. Yeah.
And what has happened for you?
The healing process has exponentially sped up. I mean, the first probably 2.5 weeks, my incisions were significantly smaller, pain down to 0. Yeah.
Cool.
Yep.
Yeah. So they did a skin flap the first time.
Yes.
And it just wouldn't heal.
Yeah, it wouldn't heal. They cleaned out the birthmark and it just wouldn't accept it. And so they tried another one from a different area on my body.
Okay.
A thinner skin graft.
Okay.
And partially it worked. I had a little bridge, and that, I think, helped me a lot with the process.
How far past the surgery before you found us?
Maybe a month. I had the surgery done in like mid-January.
Okay. And then the previous surgery, how long in between the first one and the second one?
I would say probably 3 weeks.
3 weeks?
Yeah.
They knew right away it was failing.
Yeah, totally.
Okay. And so when they did the second one, did they talk about doing hyperbarics or anything?
No, nothing. They were... Yeah, we didn't really tell the doctors that we were doing this at the start.
Right.
And
but they know now?
They know now, yes.
And what did they say?
They're amazed.
Yeah.
They're like...
Where was your surgery done again?
Up at OHSU, up in Portland. Yep.
Which surprises me they didn't think about hyperbarics for you, because one of the 14 covered conditions for hyperbarics is failing skin flaps.
Okay. Yeah, so, interesting.
Yeah, it would. But modern medicine has the availability to use hyperbarics, but it's almost a last resort for them a lot of times. With our clinic here being more wellness based, we look at preventive care. Yeah. So when somebody with your condition happens, immediately in a hyperbaric chamber would be the best thing.
Yeah.
People that are looking just at doing regular surgeries, I recommend doing some hyperbarics pre to prep the body, and then post to help it heal even faster.
For sure.
So other than the healing, you said it alleviated your pain. Yeah.
I mean, instantly. Right after the session, I would get out and it's like, oh, I can walk normally. I don't have to limp or,
So when you first started coming in, on that 0 to 10 scale, how bad was the pain?
7, 8, sometimes a 9.
And it's right where you have to wear a sock.
Yes, it is.
And so,
a lot of rubbing. I wear boots all day at work, so they're,
it's just wearing on it, which can also hinder healing.
For sure, yes. And
then you started coming in, we looked it up.
April.
1st of April, end of March type of time zone. Remind me, how many treatments did we do before we started doing light therapy? Do you remember?
Probably, I think maybe 3 sessions, like 1 week.
And then we added the deep light.
Yep. Yeah.
And did you notice a difference once we started using the lights?
I do. I think so, yeah. It was just a little bit more... the pain was a lot less, definitely. And I was a little bit more confident in keeping it clean because I was super afraid of like getting infections and whatever. And I know the blue light is a more
Yeah, the blue, how light works for folks that don't know, blue light works specifically on the surface of the skin into the dermis just a little bit, and it's a natural cleanser. So it helps keep bacteria out of a wound, or on the surface of the skin, it helps with acne and eczema, different things like that that help keep the skin clear. But it also pumps collagen a little bit. And then red light works down into the muscle, almost bone depth. Infrared light will penetrate all the way down to the bone and can actually penetrate the skull into the brain. So on Avery, we used blue and infrared at first, and then I think we switched to the deep light pad at some point.
Yep.
Also, once the wound started closing a bit. And the deep light is the infrared, and it gets, so that helps get all the way down to the bone.
Yep.
But it's also vasodilating you there. So that superaction blood we just created in the hyperbaric chamber flows heavier there, targeting that area. More blood flow, more oxygen in that area, and oxygen being that natural healer that it is, really help that flap heal.
For sure.
Awesome.
Yeah.
All right. So we're going to see you a few more times, right, Avery?
Yep.
Because you've been in 29 times now.
Yeah.
And he's not doing it every day. A lot of studies you'll read if you look up on PubMed or Google Scholar, or if you go to hyperbaricexperts.com, you'll see different studies. And every time they do a study, they do them 5 days a week for 40 hours. We haven't even reached 40 hours yet.
No,
and you're pretty much healed
I mean, at most, I was doing it 3 times a week.
Yeah.
Yeah.
So that shows me and everybody that it's not necessarily that you have to do it every day. It's just doing it consistently. Yeah, absolutely. Well, I'm super happy that we were able to help you, Avery.
Yeah,
and
totally.
Thank you for sitting down and chatting with us a little bit and sharing this information with the world so that everybody knows and is learning more about why hyperbarics can be such a benefit for everything.
Totally. Yeah, people should really look into hyperbarics. It's wonderful. It'll make your life a lot easier, a lot less painful. Yeah.
That's awesome.
Yeah.
Cool. Well, thank you again, Avery.
Yeah, thank you.
Look forward to seeing you next week.
Definitely.
Have a great day.
Thank you.
Thanks for watching, everybody. And if you would like more information, give us a call at 541-636-3278. You can also look us up on the web at newleafeugene.com. We're also on Facebook, TikTok, all those places as well. And we look forward to seeing you guys if you decide to come in and see us. Have a great day.